Welcome to this presentation on 12 tips to a more productive pain management provider visit. This talk is being presented on behalf of the Aging and Integrative Pain Assessment and Management Initiative, or AI-PAMI, a comprehensive project addressing non-opioid pain management in adults ages 50 and older living in Northeast Florida. The overall goal of AI-PAMI is the advancement of innovative pain education and patient care through the development of provider and patient workshops focused on integrative pain management. Funding is provided by the Florida Blue Foundation and the Florida Medical Malpractice Joint Underwriting Association. For more information, visit pami.emergency.med.jax.ufl.edu, or you can contact PAMI at pami@jax.ufl.edu or by phone at 904-244-4986. Again, I'd like to welcome you to this presentation. I'm Dr. English. I've been a chronic pain management specialist for 16 years, working in multiple pain clinics in Northeast Florida, St. Augustine, and Palaca. I'm a proud alumni of the University of Florida, where I received my master's in nursing. I currently teach a pain management course to the CRNA students at University of North Florida. I'm an active facilitator/educator for Sanford University, educating people on how to better self-manage their chronic pain. I'm a certified chronic pain practitioner with the American Academy of Pain Management, and I'm a certified health coach. Over the last several years, statistics have shown that more than 1 in 5 adults in the United States suffer from chronic pain. 20 years ago, your primary care provider managed your pain. Since then, things have greatly changed. Many primary care providers no longer feel comfortable prescribing increasing levels of opioids to their patients who are developing tolerance. Now they are referring their patients with chronic pain to specialized pain clinics. You may already be under the care of a pain management specialist, but feel your current provider is not helping you and you are seeking another provider who may better fit your needs. Or you may be looking for a pain management provider because you have been successfully self-managing your chronic pain, but now the pain has gone beyond what you can do alone. Whatever situation you may be in, the more prepared you are to meet with your pain management provider, the better chance you have to developing a trustworthy relationship with your prospective provider. Now, through my 16 years of working with patients suffering from chronic pain, I am honored to share 12 tips that can help guide you to a productive and successful provider-patient experience. One of the first things that you should do is to research and find the clinic that offers what you need the most. Different clinics provide different services. Some clinics are primarily interventionally invasive procedurally based, such as providing epidural steroid injections, which help reduce local inflammation. There are some clinics that are primarily medically based, and they primarily treat pain through the use of medications. And then there are some clinics that are primarily regenerative therapy based, offering services such as stem cell therapy, platelet-rich plasma. Regardless of the services offered, these therapies can depend on your insurance coverage, so check with your insurance coverage about what this clinic has to offer. Once you have found the clinic that best fits your needs, be aware that when you meet your provider, you will have a limited amount of time to discuss your pain issues. Providers are increasingly under greater pressure to see more patients in a day. Both patients and providers report feeling the time crunch as never before. In addition, because of the COVID pandemic, it may take longer to get an appointment, and visit times could be decreased to reduce exposure time to the virus. To better prepare for your initial visit, check the clinic's website and download their new patient paperwork if it is available. If it is not available, contact the clinic and request the new patient paperwork be mailed to you. Have it filled out before you leave home for the visit. For some people, this new patient paperwork can be intimidating and even overwhelming, and you may require help from family members in completing it. Some clinics may not even see you if the paperwork is not completed, as the provider does not have time during your visit to both assist you in completing the new patient paperwork and perform an adequate and safe assessment and get started on a treatment plan. Your new patient paperwork may include a diagram, as seen on the left, for you to identify where your primary pain is, as well as a place to list all of your medications. When identifying the areas that you feel discomfort in, avoid coloring all the areas you may feel discomfort in. Focus on your primary and possibly secondary pains. The other issues can be discussed as time goes on. Some facilities may want you to bring in all of your medications, so clarify that the facility needs you to bring in all of your medications to your office visit before taking in multiple medication bottles. If your medications get lost in transit, there is a possibility your prescribing provider may not replace them, especially if the medications are a controlled substance. List medications on the forms and make sure you identify why you are taking them. Don't rely on looking at the labels on the medication bottles. Sometimes the labels only list the name of the medication and how to take it, but fail to list the purpose of the medication. This information is vital for the provider. Don't rely on memory alone. An option you have available to you is to take pictures of your medications with your smartphone so that you can have the medication information readily available to your provider. If you're also looking for different ways to help you manage your medications, there are several applications that are available for your smartphone, which will also help you when discussing your medications with your provider. There are several listed here. Some are free and some may cost you a nominal fee. So now you have everything required of the clinic and you feel you're ready to meet with your provider. What you should expect from your provider at a minimum is that they treat everybody at the visit with dignity and respect, listen attentively and respond in a timely manner, and not allow necessary equipment to get in between you and the provider so as to impede any communication between the two of you. They need to be clear with the information and their advice, and they need to treat everybody at the visit fairly and without discrimination. If you're wondering what information your provider may be looking for, here are some typical questions that your provider may ask you when he sees you. He may again ask you to locate and identify the area where you're feeling your pain. He may ask you if there was any factors involved before your pain started and when it did start. He may ask you what the pain feels like, and he's looking for descriptive words like sharp or burning or aching or dull. He may ask you how often do you feel the pain. Is it constantly 24 hours a day? Is it worse in the morning? Is it worse in the evening or afternoon? He may ask you, what have you done that helps to alleviate the pain? And what have you done that makes your pain worse? So now you're being led back to your provider's room for you to meet with him. And here is where these 12 tips may help you. Before I share the tips, it's important for us to recognize that a new provider-patient relationship needs to start with our best foot forward, just like any important relationship in our life. The saying, you only have one chance to make a first impression, is as true in social settings as it is when meeting your new provider. Just as the clinic's website made an impression on you when choosing their clinic, your first impression with your provider will make the difference between developing a trusted, open relationship or not being accepted into the clinic as a patient. So things like lack of eye contact, distractions with phones, defensive postures may tell the provider you're not interested in a long-term relationship. And a long-term relationship is important because it can take time for you to get your care plan customized and working effectively for you. Nonverbal communication is an elaborate secret code that is written nowhere, known by none, and understood by all. I like this quote because it tells us it's not necessarily our words, but our nonverbal communication that is the most telling. So now, let's go over the 12 tips to a more productive pain management provider visit. Number 1, clear communication is vital. If you speak a foreign language or do not understand English very well, ask the clinic to provide an interpreter for you, or if you have somebody in mind, you can bring your own interpreter to help you communicate with your provider. Number 2, give your full attention to the business at hand. Put cell phones and other electronic devices away. Be patient and calm during your appointment. The providers have many schedule and time pressures as well, and the time they have with you is valuable, so make the most of it. Number 3, preparation equals a more productive visit. Always come to your visits prepared, prioritizing your health issues and complaints in order of severity and or concern. Number 4, major concerns should get top priority. Don't wait until the end of your appointment to bring up a serious concern or issue, or it may not get addressed. Number 5, loving WebMD or other medical sites. If you bring internet-based information with you, be open to a conversation about the relevance of that information without being defensive. You and your provider are seeking the best medical outcomes. Number 6, listen, evaluate, decide. Listen carefully and evaluate what your provider is recommending. You do have a right to refuse testing, treatments, and/or medications, but don't make rash decisions. Number 7, advocates help. They can focus on the details while you focus on the provider. It's all going to happen very fast. Research shows that 40 to 80% of medical information is forgotten immediately. The more you hear, the lower the amount remembered, and almost half of what you do remember is remembered incorrectly. Number 8, communicate with all of your providers. Share the information with all the members of your medical team at future appointments. Number 9, to ensure continuity of care, keep copies of all important documents, test results, etc. together and organized and bring them with you to all of your appointments. Number 10, it's your body, it's your visit, leave with clarity. If something doesn't seem right, speak up. It may be intimidating to talk to your provider, or you may feel your provider is not listening to you, or you don't understand the medical language that your provider is using. Ask for clarification. Being clear on your care plan is vital. Number 11, be clear and specific. Vague statements of "I've tried everything" or "I'm allergic to everything" isn't helpful, and during these times of concern for opioid misuse could possibly raise a red flag for the provider. And number 12, it's your body and your life. Above all, be an active, engaged member of your medical team. Participate in the decision-making process to get the greatest outcomes for your care. One study found that 36% of patients preferred to take a passive role in medical decision-making. For the most successful provider visit outcomes, don't be that person. Feeling overwhelmed yet? Sound like too much to take in all at once? Well, you're not alone. This is why being prepared can help you have a successful meeting with your provider. Just remember, confidence comes from being prepared. I would like to thank the Aging and Integrative Pain Assessment and Management Initiative and the Florida Blue Foundation and the Florida Medical Malpractice Joint Underwriting Association for the opportunity to present this information on ways to have a successful provider visit by developing a trusted relationship and taking an active role in your care plan to get greater outcomes. My name is Dr. Daryl English, and I hope these tips will be helpful, and thank you again for listening to this presentation.